Minnesota's Department of Corrections is dealing with an outbreak of COVID-19 at its Moose Lake facility. Greg Grell talked with Paul Schnell, Commissioner of the Minnesota Department of Corrections, about the situation.
The last week has been very challenging for staff as well as for the incarcerated people who live there. Right now, we have at present 9 people have been confirmed positive, 9 of the incarcerated people confirmed, and then we have another 22 people who are presumed positive. And by presumed positive, we mean that they have been symptomatic and have had close contact with a known positive person.
So what type of steps are you taking in Moose Lake then to try to keep the transmission down?
So across the entire system, we started out very early in this process about almost 4 weeks ago now, putting hand washing stations, doing employee screening as people come into the facility. We tried to reduce as much as possible some of the transfers between facilities, although we've had to do some of that in order to manage our population just across the entire system. And then inside, since the COVID outbreak in Moose Lake, we've done a variety of moves of people into different units to try and get quarantine and separation that ultimately to stop the spread. And right now, I'm cautiously optimistic that we are in a spot where our numbers are not going up, they're stabilizing, and we hope ultimately through containment and other just regular practices that all of us should take, that we're going to turn the corner on this and see it go down.
Now, I know you also are working with the Minnesota Department of Health on this. What type of things have they assisted you with?
We've been so incredibly almost embedded. We have an epidemiologist that's really working with us, and we're having multiple conversations daily with that epidemiologist and talking about containment strategies, quarantine, how we monitor. We just started the issuing masks, barrier masks. So it's cloth barrier masks that actually were made by the incarcerated men at Moose Lake, have been issued to all the staff at Moose Lake and all of the incarcerated men there. In addition, those masks are going to be ultimately, the goal is to make about 14,000 of those masks and distribute them to every single staff person and every incarcerated person in throughout the DOC. And all that does is just like for anybody, it provides that protection for others. It's that kind of catcher's mitt, so to speak, that allows others to be safe.
How is the staff and the inmates? How are they handling this? How are they holding up during this?
I'm really glad you asked. I gotta say, first of all, that I'm so immensely proud of our staff. Just like healthcare workers, they find themselves in a situation where they know that there's more than 20 people who've more than 30 people who've been infected, that we believe are infected, and some known, some presumed. And yet these people are coming into work, they're doing what they need to do, they're very, very professional. And I think similarly, the people, the incarcerated men at the facility have really been incredibly patient. For all of us, this is such a change in our lives. And I think if you're a person that's incarcerated, you obviously you're concerned about yourself and what all this means to you. They don't have the flexibility of being able to, go to the basement or to, go to a different room in their house. They're going where we require them to be. And I think on top of that, they also have concerns for their families, and their families have concerns for them. And I got to say that I'm really impressed with the level of patience and the cooperation that we've had from the population there. And I think it just speaks to some of the communication that has been happening, that's been positive, not perfect. This is a brand new script for all of us, and we've worked our way through it, and I think so far so good.
What about the inmates that have been diagnosed with COVID-19? How are they being handled within the facility?
So what ends up happening is, and some people you've heard about move to segregation or restrictive housing. There were moves that took place early on. Each of the wardens throughout the DOC at all of 11 prisons identified places where we could put people into a quarantine status. It was not disciplinary, but it just allows them to be separated so that we contain spread. We were using that. Now some of those segregation area, people still had access to books and those sorts of things that you would want to do, but it is a little bit more restrictive because it's harder to get access to phones, and yet we're not trying to keep people from them. It's really more about trying to contain spread. Now we're running a step-down process where after they show no symptoms for a number of days, then they move to a more open area before they get put back in general population. So we've developed this process in concert with the Department of Health, and so far so good.
I also understand that you've expanded the work release program, and some inmates are being released a little early. Is that correct?
In general, what the plan is that we will take people that we know are within 90 days of their regular release, that they're going to be coming back to whatever community they came from. And we will move them to what's called a work release status. It's not just work release. It can be job search or work. It can be school, treatment kind of activities, vocational training. All those types of things are permitted under that statute. And so we will move some people out to that status a little bit early. At any given time in Minnesota, there are several hundred people on work release. So all we're doing is expanding this program with people who are in prison for nonviolent offenses and coming up on their release date. And the goal of that is really simply to try and get additional capacity in the prisons so that when we do have the next outbreak or series of outbreaks, we have the flexibility to move population within the facility so that we can contain spread. That is entirely our goal. We knew going into this that there was a high likelihood that COVID would end up in our correctional facilities. Our goal from the beginning was to try and minimize spread as much as possible.
And then finally, Commissioner, what are you doing? How are you handling the incoming prisoners? What is the intake process for that?
That's a great question, and that's been one of the big changes that we've had to make in a very short turnaround. Generally speaking, if somebody comes out of court, they've been sentenced to serve a sentence at the Department of Corrections, they will go through an intake process at the correctional facility in St. Cloud. That's central intake. But people who were returned on a release violation, let's say a technical violation where they failed to report in with their agent or whatever, and they were sent back to prison for a short period of time as a sanction, those people would have been in the past sent back to whatever correctional facility they were last released from in most instances. And we really had to change that because obviously we want to reduce the number of outside people that are coming into the facilities. Right now, that's limited strictly to our staff, are the only people coming in. And so what we've had to do was we run all intakes, including release violators and new commitments from the courts, through St. Cloud, and they go through a 14-day quarantine before they end up in general population. And after that quarantine period, we will begin to have to move people to other facilities in order to give St. Cloud enough open beds to be able to continue to take new people in. So there's been a lot of movement. It's been a lot of work, and they've done a great job of managing this so far. But it's not without a few little wrinkles here and there. But we're making it come together, and so far it's been effective and worthwhile.
All right. Well, Minnesota Department of Corrections Commissioner Paul Schnell, thank you so much for joining us. We really appreciate it.
Thanks for having me.
Corrections officials this week implemented a Stay With Unit plan to fight COVID-19 in the prison and protect inmates and staff.